Myself Dr. Ajay. I'm working as a consultant physician and diabetologist at CANS Hospital, Vidyanagara. Well, on the occasion of World Hypertension Day, which happens to be on May 17th of every year, so today I would like to enlighten you a few points about hypertension. What is hypertension? When do we call it hypertension, which is abnormal, and when the patient has to come to the hospital, and what are the lines of management in a patient with hypertension? What is the diet plan which has to be followed in a patient with hypertension, and how can we control it to lead a better and a healthy life and to avoid complications? So first of all, more than hypertension, the most common terminology which is used is BP, that is blood pressure. That is the most common terminology which all of us come across. So what is blood pressure? It is the pumping capacity, at what pace the heart is trying to pump blood to all the organs. So basically in medical terminology we call it as blood pressure, and when the blood pressure is on the higher side we call it as hypertension. So when do we label a patient as hypertensive? So whenever the blood pressure falls more than 140 millimeters of mercury on systolic and more than 90 millimeter of mercury on diastolic, we label the patient as hypertension. So why this hypertension is important? Basically because hypertension is the leading cause of cardiac as well as renal problems worldwide. So when we take every second or third patient with hypertensive is landing up in renal problems, that is chronic kidney disease, and every second patient or third patient is having a cardiac illness. So the patients are having either a patient is suffering from either myocardial infarction, which is commonly called as heart attack, or the patient is landing up with heart failures, which means to say that heart is not adequately functioning to maintain the blood pressure.